Schizophrenia, Jacqueline's story, in plain English. Jacqueline is a 35-year-old woman, mother of two, and wife of a stockbroker. Jacqueline never had major conflicts, problems, or traumas in her childhood or adulthood. When Jacqueline turned 32, she became very depressed. Slowly, her depression seemed to increase. Jacqueline found herself staying up all night and sleeping all day, which is a symptom of depression. As time went on, her family found herself laughing at inappropriate times, saying things irrational or uncalled for, and began to have a lack of hygiene. Her husband became concerned for his wife's well-being. He asked her to visit a doctor to see if they could find the psychological reasoning for her outward behavior. Jacqueline had a hard time agreeing with this because she was in denial that she had a problem. A few weeks later, Jacqueline and her husband visited a local psychologist. After hours of examining Jacqueline's behavior, the psychologist had come to a conclusion in her diagnoses. The psychologist told her and her husband that she was suffering from the psychological disorder schizophrenia. He explained to Jacqueline that the fact that she was in denial proved that she did in fact have a psychological issue. Her depression, altered moods, sleeping routines, social behaviors, and hygiene were all symptoms of schizophrenia. He explained to her that schizophrenia was common in women, but more severe in men. He asked if either of her parents had psychological issues. She explained to him that her mother was very depressed after the birth of her third child, who was Jacqueline's youngest sister. Her mother could have been schizophrenic, which shows a trigger to Jacqueline's diagnoses. Schizophrenia is hereditary and is significantly common in families. The doctor explained to Jacqueline that there was no cure for this, although there were many medication and treatment options they could abide to. Jacqueline quickly became nervous about her diagnoses. She began worrying about her husband, family, job, and life. She felt as if she didn't want to trust the psychologist, let alone her husband, with treating her problem. It was almost as if Jacqueline just wanted to be left alone in isolation, for it to all go away. But in reality, her disorder would never disappear. The psychiatrist laid out a variety of options. These treatments included antipsychotics, antidepressants, psychocognitive, and family therapy. Her doctor suggested the antidepressant medication with psychotherapy to help her cope with the mental awareness of her problem. After Jacqueline's diagnosis of schizophrenia and abiding to her treatment of her medication and therapy, 5 years later, at age 40, Jacqueline's symptoms have lessened significantly. Her social inappropriateness as well as her hygiene and depression have moved to a much more normal level. She has restored a much better relationship with her husband, spends much of her time with her children, and tries to keep herself busy by knitting and reading books when she's alone. Jacqueline is one in 2.2 million people in America who suffer from schizophrenia each and every day.